Welfare Minister presides over the official handing over and commissioning of a newly built clinic and laboratory facility at the Maltu State Central Prisons. The Anti-Tuberculosis Coalition highlights the gains made in the battle against the stubborn respiratory disease and the huge challenges that lie ahead. The President, Abdoulaye Wade campaign caravan and that of his opponent, Macky Sall, stormed the important city of Thiès hours apart, with Wade using his visit to lash out at his former ally Idrissa Seck. And President Barack Obama weighs in on the race through contagion sparked by the killing of an African-American teenager by a white Hispanic volunteer guard. This after resisting the urge to comment on the raging controversy for weeks. These and other stories coming ahead this half hour. I am Aji Amisise. Welcome to the news. Today is World Tuberculosis Day, a day set aside to reflect on one of the world's most endemic diseases which claims millions of lives annually the world over. And in observance of the day, officials of the Ministry of Health and Social Welfare, MRC and WHO on Thursday gathered to highlight ongoing efforts to control the disease and raise awareness of its devastating impact. Modi Jara reports, though there has been a significant drop in cases and deaths, officials are warning that the battle against TB is far from won, as the research for a quicker and more efficient care continues.
This press briefing, organized by the National Tuberculosis Control Program, comes as the international community prepares to celebrate World Tuberculosis Day, which is annually held on March 24th. It brought together officials from the Ministry of Health and Social Welfare, the Medical Research Council, and the World Health Organization. Adama Jallow, the head of the National Tuberculosis Control Program, said that the Gambia government attaches great significance to the threat posed by tuberculosis and has carried out a number of strategies that have greatly reduced the spread of the disease. This, he said, has been achieved through the provision of high-quality DOTS expansion, which is crucial in controlling the disease. This has been strengthened with the expansion of TB diagnostic centers and laboratories, whilst also monitoring and evaluating procedures and processes. This, Jallow said, has led to the significant drop in cases.
The treatment success rate from 86% in 26 to 90% in 2010 as a jump in terms of the Gambia reaching or exceeding the treatment success rate. You go to the WHO report, very few countries have, even more developed countries have reached this 90%. So obviously, we must have to blow our trumpet. The Minister of Health, with the support of the Minister of Health, who is a very dynamic leader with the technicians around him, we're doing a lot.
Dr. Dyer of the Medical Research Council said the council is currently undertaking a national survey on behalf of government to determine the accurate TB burden funded by the Global Fund. The survey, he said, is the first in West Africa and will target over 50,000 people countrywide.
There have been no TB prevalence surveys in the continent of Africa in the last 50 years until 2011, when the Ethiopians completed the survey according to WHO recommendations. So this is not, not knowing the accurate burden of TB in the Gambia is not special to the Gambia. We have, those of us in the field of public health and TB specific.
The outcome, he said, will help government attain the 85% target set by the World Health Organization. The WHO country rep, Thomas Sukwa, emphasized the need to involve public, private, and corporate institutions in the fight against this deadly disease. This, Sukwa said, will complement the directly observed treatment strategy, which has been operational for decades now.
The development of collaboration and partnership between the public and the private health sector will expand the human and material resource base by tapping into the already existing systems, and goes a long way in helping countries to attain the set targets.
The need for innovative approaches, WHO rep concluded, will significantly help countries reach set targets for 2015 and 2050. The Minister of Health and Social Welfare, Fatim Baji, thanked all the stakeholders involved for their collaboration and once again underlined the Gambia government's resolve to confront the occurrence and spread of TB head-on.
We all know in Gambia that we already, through His Excellency the President, he's already providing free basic health care and also drugs. And it's not enough because the population is growing so fast. But at the same time, he stays committed to providing this service and to have also a program here to the help of our donors to continue to ensure that TB treatment are provided for free. And when we say free, it's not only the diagnosis, but it's the treatment, the food given to them, and even the fare to tell them, oh, come back. I think that is applaudable, and everyone living in Gambia should feel very lucky and privileged to be in a state that can provide these services.
She called on the media to raise public awareness on the disease and other public health-related issues to prevent its spread and galvanize collective action against the deadly disease. The Deputy Director of Health Services, Anama Demba, chaired the session and explained that a series of events will take place for advocacy purposes and called on all and sundry to join the fight to eliminate the highly contagious bacterial disease. Mamadou Diallo, GRTS.
Meanwhile, the Minister of Health and Social Welfare, Fatim Baji, on Saturday presided over the handing over and commissioning of a newly built clinic and laboratory facility at the Maltu State Central Prisons. The project was facilitated by the National Tuberculosis and Leprosy Program and funded by the Global Fund. Sam Welber reports.
Annually, the 24th of March is World Tuberculosis Day, a day when global attention is focused on the threat that TB continues to put forth on human populations despite the unrelenting efforts by medical experts to curb the menace. Celebrations marking World TB Day in Banjul culminated in the commissioning of a clinic and laboratory facility at the Mile 2 Central Prisons, courtesy of the Global Fund TB project.
In Africa, tuberculosis remains a major public health problem, accounting for over 25% of notified tuberculosis cases globally. The TB epidemic is largely driven by not only poverty, but also the negative impact of the high TB and HIV co-infections. Nearly half of all TB cases in the African region are also infected with the virus that causes AIDS.
Tuberculosis is said to be exceedingly prevalent in congregate settings such as prisons, with statistics showing TB incidences in prisons to be 50 times higher than that of the civilian population in some countries.
The National Tuberculosis Control Program under the Ministry of Health and Social Welfare is quite aware of the importance of introducing tuberculosis control services in prison. Prisons, as you may know, are conditions that enhance the spread of diseases like TB through overcrowding, poor ventilation, frequent prison transfers, and inadequate or inaccessible medical care.
A lot of progress has been made globally in the fight against tuberculosis, and we cannot wait, and for this we are asking the whole world to individually call to stop tuberculosis in your lifetime. Hence the theme for this year, which is World TB Day, is Stop TB in My Lifetime. We in the Gambia, we want to see 0 deaths from tuberculosis, faster treatment and effective vaccine for this dreadful disease.
As the global campaign against TB intensifies, the Gambia continues to register tremendous success in this crusade. The prisons, being a correction center, should be empowered, and thus the provision of quality medical services is seen as essential for inmates.
I think it is therefore very significant the construction of a wing for TB control that also touches on the welfare of prisoners and a fundamental right, that is prisoners being able to access quality medical services, become synchronous to the ideals of Gambia government and my ministry's core concept of what prison service is all about.
The construction of the Treatment and Diagnostic Center at Mile 2 Prison Service Central Prison is a testimony of our ministry's efforts to improve the health and well-being of the inmates as well as the prison officers entrusted here to take care of them. It is also in line with the government's desire Under the wise and dynamic leadership of His Excellency Chair Professor Alhaji Dr. Yaya